Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about dealing and managing depression after knee replacement surgery. So first thing I want to say is depression is very prevalent after surgery for probably a variety of reasons. You have pain, you have discomfort, stiffness, swelling, you're probably less mobile and able to do the things that you normally like to do and want to do. Your life is just really disrupted. You probably have trouble sleeping, you're stressed, you're probably tired and fatigued a lot. So a lot of these things play into this feeling of depression and having depression. And they're along the same lines. There's feelings of loneliness, hopelessness, feeling isolated. These are real things, and a lot of people will experience them at some point in your rehab and recovery after surgery. So here are some things I will share with you to help hopefully manage this a little bit better and more effectively. So one is just understand that this is normal. This is something that happens. You're not a failure. You're not doing anything wrong. It's just a normal response to such a significant event that has occurred and the rehab and recovery after that. So it's normal, but also just as important for the vast majority of folks, these symptoms and pain and everything that you're feeling are going to be temporary, and you're going to start to heal and recover and improve and feel a lot better over time. It's going to take some time. It's a marathon, not a sprint, and you have to have a lot of patience, which is easier said than done, but things do improve and get better. Number 2 is just try your best to remain active, physically active, exercise, physical therapy. Do what you can. That's what I always tell people. Doing some is better than doing nothing at all. Of course, exercise and activity is important for the rehab and the recovery and building your range of motion and strength, but it also has benefits for just your overall well-being and health and wellness of your body. So trying to stay consistent, at least doing a little bit, is better than doing nothing at all and completely avoiding it. Number 3 is the counter to that is you want to make sure that you're resting and making sure you're pacing yourself throughout your days. You don't have to be going go all the time. Your body needs to rest. Your body needs to recuperate. Now, even more than ever, you need to get sleep. You need to just get off your feet and rest and elevate your legs sometimes. And that's perfectly okay, and that's part of the healing and recovery process. Number 4 is try to incorporate some techniques that are going to help you relax, are going to help bring you calm, help bring you some mental calm and awareness and stability. And this is different for everyone. And I'm no professional at this, but just think, use kind of some common sense things that you might find to be relaxing, such as breathing techniques, such as walking or another activity if walking is a little uncomfortable. Listening to music, reading a book, watching a movie. Maybe cooking a meal is relaxing for you and meditative. Journaling, people find very helpful. Spending some time outdoors in nature or with a pet or a dog or a cat or a pet. There's a lot of different things out there. You don't have to get too fancy. You don't have to get too clinical about it. Find those things that help you to relax, help you to stay calm throughout this journey. Number 5 is don't be afraid to look for help. And look for help in social support. So maybe you have family, maybe you have friends, maybe you have social support online through a Facebook group or other form of social media, or maybe you have Zoom calls that you do with a loved one or someone who's gone through a knee replacement. Seeking that help, seeking that social support is going to help you feel connected, part of what's going on in the world. Probably what you're doing right now in your life is probably rather disrupted right now. You might be out of work or just not doing what you normally would. So maintain those social connections as best you can. And the 6th one is just seeking help from a professional as well. And don't think of yourself as a failure. Don't think of it as anything wrong or abnormal. It's perfectly okay. Seek the help of a therapist, a counselor. They may prescribe medications, which is perfectly okay and can have tremendous benefits and help. So don't be afraid to seek these avenues of support as well. I hope this gave you some useful insights. I'd appreciate it if you are interested to hit that subscribe button and turn on the notifications. I post videos every other day related to knee replacement surgery, frequently asked questions, rehab, recovery, exercises, and everything else. Be sure to leave your comments and questions below, and I'll do my best to get back to you. Thank you very much for watching.